me welcome the class of 2023 to the fall blessing of the hand ceremony here at Carson-Newman University. Today you will experience, as many nurses have experienced before, a charge to be missionally driven and holistic in your care when helping your future patients. We are joined today by some of your nursing professors and friends of the university. Today, we will have the privilege of hearing from Assistant Professor of Nursing, Ms. Jenna Frost. You will be led in the oath of compassionate patient care by Associate Professor of Nursing, Ms. Pamela Rogers. And then the presentation of pins will be directed by our Chair of the Nursing Department, Dr. Lana Spence. And Dr. Andrew Smith, Associate Professor of Religion, will have the distinct pleasure of blessing over your hands. Let us welcome Dr. Smith to the stage for the opening prayer.
Would you pray with me? God in heaven, we come together tonight in gratitude. Gratitude for the coming of fall and a beautiful crisp day. Gratitude for colleagues that surround us, and gratitude for the chance to touch others with healing and hope. Come to this place and be among us and offer us a share of your healing spirit. We ask this in the name of your Son, who is Jesus Christ. Amen.
One of you asked me about the background of this, so here it is. Dr. Arnold Gold was a professor at Columbia University for 58 years and was a world-renowned pediatric neurologist. If you look up Dr. Gold, which I happen to have done today, some of the first pictures that come up are of he and his wife, or of him showing affection to a patient of his named Christopher Savage, who he cared for at then Babies Hospital, now called Morgan Stanley Children's Hospital in New York. Dr. Gold passed away in 2018 at the age of 92, but his legacy lives on. In the 1980s, technology was allowing healthcare professionals to diagnose diseases in new and faster ways. And while Dr. Gold celebrated this progress, he became increasingly worried. He worried about that connection between patients and those who cared for them. He worried that that connection was being diminished or falling away. It is that human connection, the careful listening, the paying attention to patients and their families, that remains essential. And Dr. Gold believed in that connection. As a professor, Dr. Gold would watch students at graduation, that white coat ceremony, pledge an oath to compassionate care. But then Dr. Gold thought, it's too late. So Dr. Gold, with the help of his colleagues, his wife, Sandra Gold, and the staff of the Arnold P. Gold Foundation, started a new ceremony, that white coat ceremony. The white coat ceremony emphasizes compassion and the human connection from the very beginning of clinical training. With permission of the Arnold P. Gold Foundation, Carson-Newman has adapted this ceremony into the blessing of the hands. In partnership with Arnold P. Gold Foundation, the American Association of Colleges of Nursing establishes a collective voice for academic nursing education through the promotion of excellence and innovation. This association works to establish quality standards for nursing education while also assisting schools to implement those standards. With that AACN values of leadership, innovation, collaboration, integrity, and agility, combined with Dr. Gold's legacy of compassion and empathy, we encourage you to embark on this journey of developing holistic, compassionate patient care with a mission for service. Thanks.
Hello. My name is Jenna Frost, and I teach mental health nursing for the undergraduate nursing program. And I have lost count of how many of these blessing of the hand ceremonies that I've attended, somewhere between 5 and 10, but they never get old. I think they're always so special and touching to me. I did the traditional pinning and white coat ceremony when I went through nursing school, and so I think it's really special to have your hands blessed at the beginning versus the end. It's not something that I got to do, so I'm glad I get to see you all do it. I have also been the guest speaker for the blessing of the hands a few times in a row now, and my speech will be much the same. I have contemplated rewriting this speech, doing something new, but I don't think that my message has changed. If anything, as this pandemic continues, it's becoming more true and more applicable. So I'm not sure if you've heard my speech in full or in parts or not at all, but I encourage you to be present in this moment and listen. You will do great things as a nurse, and my time has taught me that it really is all about your hands. I come from a family of nurses, so it was easy for me to jump on the bandwagon and say, me too. I was never able to answer the question of why do you really want to be a nurse until July of 2011. I was set to begin nursing school the very next month, and my dad had become very, very sick. He would spend the remainder of 2011 in the hospital, discharged home on Christmas Day. He spent almost 6 consecutive months in the hospital. I watched my dad get sicker and sicker as the weeks went on. I traded shifts with my mom, staying all night, and I watched day after day, night after night, nurses care for my dad. I will never forget one day showing up to the hospital alone to take my shift of sitting with my dad. I knew that hospital like the back of my hand, especially the 11th floor. So when I turned the corner to enter his room is in complete shambles. What I didn't know then, but I do know now, my dad's room had experienced an emergency situation. They had ran a code in that room. Most importantly, my dad was nowhere to be found. He had been transferred to the ICU. I remember panicking, having tunnel vision. I was alone and scared. My dad's nurse found me and explained what had happened and led me to his ICU. But let me tell you, it was her hands. Her hands on my shoulder grounded me. Her calm voice and her hand in mine as she escorted me to the ICU made one of the scariest days of my life a little easier. I knew then, in that moment, that I wanted to be a nurse. I wanted to be that comfort for someone and their family as that nurse had been to me. Fast forward a few years, and I have graduated, and I'm working as an RN at UT Medical Center. I worked on the same floor for 5 years on a vascular surgery and transplant floor. I can tell you some pretty average things that my hands have done as a nurse. I have opened more pills, filled more ice cups, emptied more urinals than I can count. I have charted thousands of care plans and nursing rounds, and I have made hundreds of phone calls to phlebotomy to hunt down my labs. I can tell you some downright sad and hard things that my hands have done as a nurse. I have held hands with patients when the doctor told them that they were in antibody-mediated rejection. I have held hands and put hands on a patient's shoulder when they are told the news that their blood work was antibody positive and they actually wouldn't be able to receive their life-saving organ transplant. I have held hands with patients when their pain was so great that medications did not take the edge off. I have used my hands to perform CPR until they were sore and ached. I have used my hands to comfort family members after they watched their loved ones die, or while they watched their family members be resuscitated following a code. And I have held the hands of dying patients both in peaceful and traumatic situations. I can tell you some really awesome things that my hands have done as a nurse. My hands have worked feverishly to hold pressure on a bleeding graft and ruptured fistulas. My hands have worked skillfully and carefully to open fluids and medication in rapid responses. My hands have had to be calm and steady to draw blood, manage art lines, insert IVs and catheters. My hands have changed dressings, replaced wound vacs, suction trachs. They have worked quickly like a magician to clamp art lines and central lines and wound vacs to stop life-threatening bleeding. I can tell you some really joyful things that my hands have done as a nurse. I have clapped and cheered when I see a patient who has been on dialysis for many years come to the hospital on a moment's notice for a kidney transplant. I have held hands with patients before surgery when they receive a life-saving kidney transplant. I've held hands with family members when they get a call from the OR that their loved one's blood flow was restored via bypass and they didn't have to have an amputation. I have clapped and cheered for patients who regained strength and the ability to speak following strokes. My hands have clapped and celebrated with patients who learned to walk using their new prosthetic. And my hands have hugged coworkers many times for their accomplishments. Now, I work as a psychiatric nurse practitioner doing consults in a nursing home here in Jefferson City. And let me tell you that during this pandemic, my hands have been my greatest asset. These elderly residents, most with a degree of dementia, have had their freedoms of leaving their rooms in the facility freely stripped from them, not to mention the ever-changing rules of not seeing their families for months at a time. On top of that, their routines have been shattered. There are no group activities or communal meal times, no exercise class, no free roaming of the facility, but my hands. I have been able to provide physical touch, albeit with PPE and gloves, but physical touch that is so important for survival. I have held their hands, I have hugged them, I have bridged the gap between complete isolation and the love of their families. This pandemic has really shown me that my hands are a blessing. I often think about Jesus and how he used his hands to serve and to heal, and here are some of my favorite examples. Mark 7:32 through 35. There, some people brought to him a man who was deaf and could hardly talk, and they begged Jesus to place his hand on him. After he took him aside away from the crowd, Jesus put his fingers into the man's ears. Then he spit and touched the man's tongue. He looked up to heaven and with a deep sigh said to him, "Be opened." At this time the man's ears were opened, his tongue was loosened, and he began to speak plainly. Luke 4:40. At sunset, the people brought to Jesus all who had various kinds of sickness, and laying his hands on each one of them, he healed them. Luke 13:10 through 13. On a Sabbath, Jesus was teaching in one of the synagogues, and a woman was there who had been crippled by a spirit for 18 years. She was bent over and could not straighten up at all. When Jesus saw her, he called her forward and said to her, "Woman, you are set free from your infirmity." Then he put his hands on her, and immediately she straightened up and praised God. Now, I'm not saying that you will use your hands to call out demons and heal leprosy, but as you begin your clinicals, my prayer is that you see your hands as a gift, as a vital tool as a nurse. Your hands will sometimes work fast, and there will be times when they are idle. They will feel useless at times, and they will feel strong and capable at others. Some days they will let you down, but more days than not, they will be your lifeline and a great resource. So in conclusion, I know that this ceremony will always be special to me, no matter if it's my first time or my 101st time, because being a nurse is one of my most favorite titles. It is a gift and a ministry. I hope as you begin clinicals as a nervous, eager nursing student and finish out clinicals with more confidence and an ever-growing skill set, and then move on to complete your first year as an RN and someday become a senior nurse, that you remember this day and you remember the power of your hands.
All together now. Okay. I solemnly pledge myself before God and in the presence of this assembly to practice my profession faithfully and to live my life in a way that reflects the values of truth, beauty, and goodness. In the care of individuals, families, and communities, I will provide safe, effective, and compassionate nursing care, demonstrate sensitivity to cultures and values, advocate for holistic needs, maintain confidence of personal matters, collaborate with the healthcare team, and evaluate the standards of my profession.
Aaron Arnold. Logan Atchinson. Braxton Beal. Allie Collins. Mackenzie Kahn. Hope Doyle. Lainey Forbes. Emma Gurley. Bryce Hanley. Jacob Hearn. Abigail Hildenbrand. Cassie Moore. Ginger Myers. Kinsey Palmer. Stephanie Ramos. Haley Ramsey. McKenna Rejo. Olivia Russell. Tabitha Tucker.
I have long believed that people cannot give what they have not first received. So for you to bless others, you must receive a blessing. And so I ask that you take your hands and hold them in front of you like this, a posture which in many Christian tradition represents our holding our hands out to receive the elements of Holy Communion at the altar in which we receive the blessing that Christ has offered to us. Hold out your hands and receive a blessing. Healing God, you have given gifts to all of us. Gifts of wisdom, gifts of knowledge, gifts of faith, and gifts of healing. Standing on the precipice of a new season of our lives, standing in the midst of a difficult moment in history, we ask that you would bless our hands. Place into our hands gifts of healing. Make them steady in moments of anxiety, quick in moments of urgency, and firm in moments of conflict. And in those times when human lives that are precious to you, lives that are waning, the lives of those who are poor, the lives of those who are frightened, the lives of those who are misled, the lives of those who don't know where to turn. When their lives are in our hands, make us people that are so in tune with your Spirit that your presence is mediated through us. Accept us in this moment. Accept us as your instrument in these times, please. And give us your blessing. Amen.
Thank you, Dr. Smith, for that beautiful blessing. So, to the class of 2023, congratulations. The journey is just beginning. There will be times when your hands will almost fail you, but trust that you're prepared, trust that you're called, and know that you have the support of your faculty all the way through and beyond. Welcome to the greatest profession, in my opinion, that there is. And as Dr. Wood was playing today, where he leads me, I will follow, and then he leadeth me, correct? Okay. Those hymns resonated in a very new and real way, and they were perfectly selected for this moment. Thank you. Thank you, Dr. Wood. So do remember where he leads, you'll follow, and that he leads you all the way. And again, I just want to say welcome, congratulations, and again, thank you for everyone who has spent their time preparing the ceremony. So if you guys would join me in just celebrating the entrance into clinical practice for the class of 2023. Congratulations, and you are dismissed.